Welcome back. We're now joined by Dennis Wilson, who is in fact president and CEO of Delta Dental of New Jersey. Good to see you, buddy.
Good to see you, Steve.
Last time we were together, we were in a meeting in your conference room, brainstorming, talking about oral health. And we're taping this on the 13th of July. The world has changed dramatically. What's it like for you and your colleagues?
You know, changed dramatically is probably an understatement. The world is upside down, but I'll say moving forward, thankfully we've invested significantly in technology and other resources that allows us to do most of what we do virtually. But there's nothing to replace face-to-face, hand-to-hand human contact. But we move forward.
We have no choice, which is why we're producing like this. And hopefully we're getting better at this. And let me also disclose that Delta Dental is one of the very generous underwriters of the programming we do, particularly around public awareness regarding oral health. Put this in perspective for us. COVID and dentistry / oral health, larger issues. A, how important. B, the precautions being taken by your members.
So it remains, as it always has been, extraordinarily important, right? So in the lockdown, I'll call it, period that we've had where dentist offices were closed, individuals, patients, our members were without benefit of oral health care, of dentistry for, well, almost 3.5 months. So, I think that was appropriate, was to keep people safe. All the dentists will agree. But as we kind of roll forward, and as of the end of May, as dentist offices were allowed to open and perform most procedures, everything except cosmetic-related dentistry for the most part, we have to remember that dentists are actually good at this. Dentists are very, very experienced, dating all the way back even pre the AIDS crisis, right? Dentists were very good through SARS, through H1N1, through seasonal flus at prevention and cleansing, sanitizing, all the protocols that are necessary to keep not only their patients, but themselves, their staffs safe.
Dennis, I want to follow up on something you just said. All these precautions are being taken. 3.5 months where people were without the dentistry, the oral health that they needed. Let's deal with public perception. What are the messages that need to be gotten to folks in New Jersey? You have colleagues in Connecticut as well, right?
Yes,
and in the
absolutely.
region. What's the message that needs to get to them around their oral health and what's going on to protect them when they come in, because they need to come in?
Yeah, absolutely, Steve. So I think the foremost message when people ask the question, is it safe to go back to the dentist? And the direct answer is a qualified yes. And by that, I mean, as I said, dentists are good at preventing the spread of disease. They're good at sanitizing. They're good at infection control and all of those protocols. But also, the message that I would put out to anyone that's considering going back to the dentist, and they should consider that very, very carefully, is you have to be a mindful, good healthcare consumer. And by that, I mean, make sure when you call and make that appointment that you ask the dentist offices, what precautions are they taking? And it should sound something like this. It should sound something like, there is not going to be a full waiting room. As a matter of fact, we'd prefer that you not wait in a waiting room. Wait for a text from us while you're waiting in your car to come in and see the dentist. And when you're greeted by that front desk, that individual should have a mask and gloves on, and perhaps some kind of plexiglass shield in front of them. And when you go into that dentist chair, there should be no one there sitting while you're waiting on the outside. There should be at least 15 minutes between appointments so you can go in there safely, so the dentist has the opportunity to to clean and sterilize the area. The other question you should ask is, does the dentist still use ultrasonics? And by that, I mean, you've been to the dentist office. You know, when you sit down, you usually have a napkin put on you or something like that. And you inevitably get wet, misted, and all of that. So that's probably the number one thing that a dentist could do, is make sure they no longer use that ultrasonic that sprays aerosol, sprays liquid, and so forth. The CDC and the state of New Jersey has guidelines that anybody can access. You should ask those questions. Simple one: are you adhering to the Center for Disease Control guidelines?
Got it.
It's as simple as that.
Then that's what an informed consumer, an engaged consumer has to ask those questions. Real quick, Dennis, the dentist support program, real quick, you guys are doing that with the Connecticut folks?
We are, Connecticut and New Jersey. We've developed a two-pronged program. One, prior to dentist offices being open, or open only for emergencies, we offered a program that gave them in advance of a couple of months payments that we would have paid them in a normal time. So it allowed them to bridge, if you will, an interest-free loan, is what it boils down to, with very easy payback terms. That's number one. Number two, as dentist offices open at the end of May through June and through July, we provide a supplemental payment of $10 per patient visit to provide a supplement and a help and aid for the extra cost of personal protective equipment and other things that the dentist office is now required to do.
It's important stuff. That is called the Dentist Support Program. Dennis Wilson is president and CEO of Delta Dental New Jersey. Also, check out their website, which will be up throughout this segment, because we'll also talk about their relationship with the Special Olympics of New Jersey. I'm honored to be a part of the annual fundraiser that's being held, which is a golf outing. This will be seen before. I believe it's on August 21st at Essex Fells Country Club. This will be seen before and after. So, but check that out, because helping Special Olympics is something that all of us need to be engaged and involved in, as your organization is. Dennis, thank you so much.
Thank you, Steve.
I'm Steve Adubato. Make sure you join us next time. Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, PSC&G, Hackensack Meridian Health, the New Jersey Education Association, Gibbons PC, New Jersey Institute of Technology, NJM Insurance Group, the Fidelco Group, and by Wells Fargo. Promotional support provided by the New Jersey Business and Industry Association and by ROINJ.
Day after day, we rely on electricity for all the ordinary things in our lives and for the extraordinary.
Mom! Hey, sweetie. How are you? So, tell me about the game.
I scored 2 goals.
That's my boy.
At PSEG, our commitment to you now is more powerful than ever.